Hi, my name is Kim Fisk, and a friend cared enough about you to send you this information. I had a friend that cared enough about me to tell me about it as well after she had used this stem cell technology to help her get over long COVID. Little did she know when she mentioned that word to me that my husband has been dealing with bone on bone knees for several years, and we had looked into stem cells for his knees because he didn't want to have new knees at 57. And so we already knew about it, but it was so expensive. It was so invasive and painful. He just said, you know what? I'm just going to be a tough guy and eat ibuprofen and kill my kidneys. Well, he didn't say that part, but that's what was happening. And I was worried about that. So when she mentioned that, it got my attention. And I really just want to tell you that this has absolutely changed our life because within just a few weeks, he was not taking ibuprofen anymore. And did I mention he was highly skeptical? Like he said this was snake oil. He thought, rolled his eyes. Like it was really fun. I said, you know what? It's not a religion. You don't have to believe it. Let's just try it. In fact, don't believe it and let's just try it. Within a couple weeks, ibuprofen done. Within a couple months after that, he was back to playing golf and pickleball. It's actually given him his life back. So I'm going to go over a few things with you so you have a better understanding of what it's about and how possibly it could help you. So the company's name is Lifewave. You are going to hear, like even my husband's story is not to tell you that it's going to help you in the same way. We're not making any claims, medical claims or diagnoses or treatment plans, but we also want you to check with your own medical doctor for your specific needs. But here's the problem. The problem is we age because our stem cells are going dormant. When we're babies and we're growing, our stem cells are active and doing all the hard work. But as we age from 30 on, basically my age 60, we have very few stem cells at the ready, providing any ammunition against disease or conditions or pain. And so this is why we age, by the way. It's not the other way around. And so the interesting thing is wondering how these patches actually get in there at the stem cell level. Well, when I first saw these patches, I thought there was stuff going in the body. How many of you thought that? Because that's what we're used to. Hormone, pain patches, nicotine patches, they have chemicals and medicine going through the skin. This patch has none of that. There is absolutely no chemical going through the skin. There's no contraindication for any other medicines that people might be taking. You can have a pacemaker because it won't interfere with anything. It's just a patch that is based on what's called phototherapy, and I'm going to go into that. So the sun is a good example of phototherapy. The actual scientific name is photobiomodulation, and it's where light is going through the body and impacting it at the cellular level. And this is what happens with sun. Sun, we know, goes through our body and through the processes here and creates vitamin D. Sun doesn't contain vitamin D. It's a signaler to our body of what to do based on the UV wavelength of light. Red light therapy is all the rage right now because the light is in a wavelength that activates the body at the cellular level and that impacts change. So these are forms of photobiomodulation. But the interesting thing and cutting edge in this technology is we are the light source. Our bodies emit light. Heat is just invisible light. Okay, we all know we emit heat, but look at what thermal imaging shows us, or if you put night vision goggles on, that's going to show you the light that's coming not just off your body, but even strong enough to come through your clothes. That was pretty shocking to me. So what happens with the phototherapy patches is the patch goes on your skin anywhere, and it's reflecting back the light that's coming off of you. And it's doing it in certain pathways that are embedded in the crystal, in the nanocrystals of organic lattice material in each patch. And it activates and signals, just like the sun, just like red light therapy, it signals to the body what to do. And in the case of the star of the show patch, that's the cutting edge thing that is absolutely rocking the world, is this stem cell activation. It's called X39. And how it's signaling the body is to actually create what's called copper peptides, GHK-Cu. And that we have discovered, David Schmidt discovered, the inventor, discovered that is the pathway to stem cells. So he worked 10 years at one of the top stem cell research institutes in the world to get this right. And it's all done with a little patch that reflects back the body light in certain pathways. And in this case, this patch activates what's called copper peptides, GHK-Cu. But you don't have to even take our word for it, because to get a patent, which all of the LifeWave patches have patents. The X39 has over 80 global patents. To get a patent, you have to prove it medically. You can't just say, hey, it worked on my grandma in the basement. They actually have to show the clinical studies that David Schmidt presented to the patent office. And it shows you in the, I'm not going to read it, but these are the things that it's been proven GHK-Cu does. And one of those is including activation of stem cells. And by the way, you can't patent a placebo. So I hear that all the time. Oh, it's a placebo. Yep. Patents don't happen for placebos. So what happens with the X39? Well, these are some of the results from the patch as it's elevating these copper peptides. One of the things it talks about is anti-inflammatory. Well, this is my friend Kathleen, who had horrible autoimmune, and she was bedridden, basically just being pumped full of cortisone, and basically didn't have a life, in a lot of pain. This technology has given her her life back. Her rheumatologist broke up with her and said, "You're free to go." And she now is back to work, walking the beach, having got her life back, basically. GHKCU is also very powerful for the skin, as you can see in these examples. And my friend Shayna with another autoimmune issue. Also, she had a bulging disc. Absolutely things I can't even show you because I don't have pictures for them, but they are absolutely arthritis, bursitis, neuropathy, things that are absolutely at the cellular level. The patch doesn't heal you, remember. The patch is signaling the body to do what it does best. And once you've given it that, it takes over and does the work. Okay, Patty's 3-month transformation here. Look at collagen, look at anti-inflammatory, look at the skin quality, and just her happiness. I don't think it turned her hair red, but it might have given her some more hair. But you can just tell. Wound healing, it's another thing GHKCU does, wound healing. And as we get older, healing is very hard to do because you just don't have that ammunition. So the X39 patch is this. The studies show you want to expect to wear, it's a patch a day that comes in a sleeve of 30. One patch a day, you want to wear it 1 month for every decade in age that you are. So do the math. If you're 30, that's 3 months. My age, 60, I'm going to expect to wear it. It's not a one patch wonder. You might have unexpected results sooner, but you want to have that expectation. And the cost is $99 wholesale. What? That was so shocking to me based on what we had discovered about the other stem cell treatments. Okay, the partner patch we put with this because it will help, it's a booster for that X39 to get down the road faster and those stem cells to do the actual cellular healing. The Eon patch helps with reducing and eliminating inflammation. Every medical person I know says at the root of disease, of pain, of any condition is inflammation. This patch is the one I use actually primarily when I'm out and about, run into people with pain, because the effects of it happen so fast, just like this picture shows here. It absolutely reduces inflammation, and that is felt from a reduction of pain. But it also, from a cellular level, it helps the X39 and those stem cells that are regenerating get in and do the actual healing, because inflammation will block healing. So this patch is the dynamic duo to the X39. Okay, and we also just have, as you get started, we have below wholesale pricing on some entry packs. It's the bundles. The person that helps you get started with this will put this together for you, but primarily these are the two below wholesale pricing that we start people with. We get you down the road with 1 month of X39 primarily to get that one. That's the one that's just going to keep coming for the 99 wholesale that I talked about earlier. And then the rest of it, I front load with primarily Eon, the Eon patch, because that's the anti-inflammatory, and that's the one you don't have to rebuy that again in the next month or two. You're going to have that in advance. So, and the advanced is usually for people that have two or more people in a family that want to get started. So these are the prices. It's absolutely mind-blowing to me that it is at this price point. And so you just want to get back with the person who invited you and told you about it because they did care enough about you to help you in this reverse aging process. You'll be so surprised. We'll see you on the other side of patching.